start now.
Good evening, everyone. Thank you very much for joining us this evening. This evening, we hope to go through a presentation to support entry into dental foundation training for September 2024 start. This is recorded and a recording will be available. The link will be sent to all dental schools, but it'll also be available on YouTube. So all applicants should hopefully have access to today's webinar. Following my webinar on the recruitment process, you will have an opportunity to ask questions and we'll try our best to answer any questions that you may have. I'm also joined this evening by our team who run the recruitment, and they'll be able to give you advice on the administrative aspects as well as 3 foundation dentists who will be talking about their experiences and giving their viewpoint. To introduce myself, I'm Sana Movahedi. I'm Postgraduate Dental Dean for London, Kent, Surrey and Sussex. I'm also currently the Lead Dean for Foundation Training. So this presentation is relevant to dental foundation training recruitment for 2024-25 training. It applies for anyone who's applying via the national recruitment for dental foundation posts within England, Northern Ireland and Wales. There is a separate process for application for vocational training in Scotland, and this webinar will not be covering that. What we hope to get from this webinar and what we hope to get across is to reassure you about the processes of dental foundation training recruitment, to give you the details of the process. We might not be able to confirm all the dates for the dental foundation training recruitment for a number of reasons, so please do bear with us. The presentation, as I said, will be made available on YouTube, but the link will also be shared with the Dental School Council, and an actual copy will be available on the CobDent website. So what is dental foundation training? Dental foundation training is a 12-month employment and training, which is generally within NHS general or personal dental services. In England and Wales, dental foundation trainees are employed by a lead employer and they're hosted at training sites. In Northern Ireland, they are not employed by the lead employer and are employed by the actual training sites. There are also a number of 2-year, 24-month schemes which combine dental foundation training and dental core training year 1. Satisfactory completion of foundation training, which happens at the end of dental foundation training, is the gateway to entry to the NHS performer list in England and Wales, and to the health boards in Scotland and Northern Ireland as an independent practitioner. So the hope is, upon satisfactory completing foundation training, you will no longer be conditionally included in the NHS performer list, and those conditions will be removed, and you will be working as an independent practitioner. This is a recruitment process which is competitive, and it's for an employment position, a job. It's an interview for employment. It is not an examination. So what is satisfactory completion of dental foundation training? Satisfactory completion is reviewing your progress and your competence, and it's done twice a year by a panel in absentia, usually 5 months after starting and around 10 to 11 months after you have started. And the panel review reports from your educational supervisors, your training program director, as well as evidence that you have gathered from your assessments and inputted into your e-portfolio. You are required as part of dental foundation training to demonstrate a broad range of competencies, and these are laid out in the dental foundation training curriculum, a copy of which you can find on the CopDent website. In some cases, your training may need to be extended beyond the 12 months if the panel decides that there are competencies that you've yet to meet and that you would benefit from additional time spent in a supportive environment. To be able to show satisfactory completion, you need to demonstrate satisfactory progress, but you also need to complete a minimum of 12 months of full-time training. So as I said, assessment of satisfactory completion is an in absentia review of the supporting evidence. You do have a right to review and appeal a recommendation that the panel make if you think the decision is incorrect. Quality management of dental foundation training currently aligns to the updated September 2022 Blue Guide version that is available for you to access on the CopDent website. So what do I hope to cover in the next few slides? The number of posts, the recruitment process, special circumstances, key dates, how to apply and how you'll be assessed, as well as preferencing and quality assurance. So for 2023 entry, this was the number of applications that we had, 1,079. The number that went through and sat SJT exams was 1,053. And so far, 898 offers have been given. There are some more offers that are currently being provided. So this number will change in the next few days. This is just to give you an indication of the numbers involved in the current year. So what's the aim of the recruitment process? The aim is to rank eligible applicants and allocate them to either a 12-month dental foundation training program, which is full-time, a longitudinal or 2-year or correctly known as Joint Dental Foundation Core Training Scheme across England, Northern Ireland and Wales. And after my presentation, we will have talks from foundation dentists who are doing 12-month foundation training program or are undertaking the 24-month Joint Dental Foundation Core Training, so you can gain some more information about what those different schemes involve and what the choices are. So ranking will be based on SJT only. There will be no interviews as part of this process. Therefore, your SJT assessment will give 100% of your ranking score. Please do remember that the popular schemes practices, they're much more likely to be very competitive and you'll have more applicants per place. Do try and rank as many places as you are likely to go to. Do note that the process complies with employment law requirements. So, what about candidates with a disability? All applicants are encouraged to declare any disability on the application form, and this is to make sure that they're supported through the process. We cannot consider disability retrospectively, so the absolute deadline for declaring this is Tuesday, the 5th of September 2023, which is the application close date, after which point no adjustments can be made, and allowances and adjustments will be made in line with current policies. We also support applicants with special circumstances. Again, these must be declared at point of application and evidence. Again, retrospective applications cannot be considered. The 3 eligibility criteria. Criteria 1 is an applicant that is a primary carer for someone who is disabled, as defined by the Equality Act of 2010. Criteria 2 is an applicant who has a medical condition or a disability for which they require ongoing follow-up in a specific location, and that specific location is an absolute requirement. Criteria 3 is someone who has parental responsibilities, someone who is responsible for, is a parent or is a guardian of a child under the age of 18. So what posts are included as part of this national recruitment process? The posts that are included are all the posts that are available in England, Wales and Northern Ireland, which will commence in September 2024. Please do note that the training practices and the training sites and educational supervisors for 2024-25 won't be confirmed until mid to late 2024. So any information that you're currently seeing on websites is for guidance only and is subject to change, as supervisors and practices may opt to drop out of training at any point. We highly recommend that you don't contact or visit any practices before you have been formally offered a training practice. And again, to reinforce, Scotland will recruit separately to its vocational training programme, and we do not cover that in this presentation. So what regions are there? These are the current regions. So we have North West, Midlands and East, South West, Thames Valley, London, Kent, Surrey and Sussex, North East, Yorkshire and Humber, Wales, Northern Ireland. And I should mention that East of England is also a further region. So the key dates are applications open on Tuesday, the 8th of August, 2023, and they close on the 5th of September, 2023. The window to sit a SHATI examination will be Wednesday, the 8th of November until Wednesday, the 16th of November. Preferencing of schemes, initial offers and final offers, the exact dates have yet to be confirmed, but we hope that most UK graduates will have had their final offers by June 2024. And you'll have an opportunity to preference your schemes in May 2024. Please remember that every year there will be a small number of people who will unfortunately not apply on time and apply after the applications close. Please note that no exceptions can be made under any circumstances and late applications will not be accepted. So please try and make sure that your applications are undertaken in a timely manner and that you don't miss the deadline. So how do you apply? This is the website link, which is on Oriel. The advert, the application form, the person specification, and the applicant guide will be available on the Oriel website from the 8th of August up until the 5th of September only. All communications from the Dental Foundation Training National Recruitment Office and team will be sent via Oriel. So here's some of the questions that come up on the application questions, and you may require some guidance on them. So the first question is, if you're not registered with the GDC currently, please explain why you think you'll be eligible to gain full UK GDC registration. So please simply answer no to the question about GDC registration, then explain when you expect to register in the free text box. So for example, you say, I'm currently a final year dental student and will gain my GDC registration on completing my BDS. Your date of qualification, if you've yet to actually attain this, please confirm your future approximate date, for example, 1st of June 2024. Will you be required to undertake dental foundation training as the only route to access the NHS dental performer list? This is another question that's on the application form, you should answer yes if you're expecting to graduate from a UK dental school. So how will you be assessed? It will be 100% based on your SJT score. There will not be an additional element of an interview at all for the 2024 DFT entry. So it will be purely on the SJT. These will be held at Pearson VUE centres, and you will have a choice of which centre you go to. There will be multiple choice answers, and it will be in exam conditions, and you will have 105 minutes to answer the questions. There'll be an additional 5 minutes to complete an evaluation form. If you have declared a health condition or a disability at the point of application, then additional time can be accommodated depending on the recommendation. Do note that the SJT is mandatory, and again, to reinforce, it will be 100% of your overall score. There will be no interviews. The SJT will take place between Wednesday the 8th of November and Wednesday the 16th of November. You'll be able to book your centre and time slot online. You'll be emailed to your notified account and sent a message via Oriel when booking becomes available. If you are having trouble finding a time slot, then do contact the support portal link, which will be provided to you. Do note that bookings are made on a first come, first served basis, so please try and book early to secure a convenient time slot for yourself. The support portal link has been provided in this presentation. So what are SJTs? SJTs are a measurement method designed to assess your judgment in work-relevant situations. They focus on your professional attributes and behaviours such as integrity, empathy, resilience, and working under pressure. They are not a test of clinical knowledge or skills. Please note that there are some example SJT questions that are available on the CobDent website. So here's an example SJT ranking question. I'll allow you to read it, a few minutes for you to read this particular question. In this ranking question, you have to rank them in order of the response to the situation, with 1 being the most appropriate and 5 being the least appropriate. This is an example of a multiple choice question that can be found in SJT. And in this type of question, you're choosing the 3 most immediate appropriate actions to take. So please do have a look at the CobDent website. Look at the examples of the SJT questions on the CobDent website. So, what about schemes and regions? Details of the schemes, and in some areas it will be regions, will be published on Oriel. Preferencing is to schemes or regions usually, rather than individual practices. And once you've been accepted to a particular area, there'll be a local allocation to individual posts and practices. The preferencing process will occur in spring 2024, and we will provide the dates as soon as they are confirmed. You are advised to positively preference all areas in which you're willing to train. If you don't do that, it may result in you preferencing yourself out of the recruitment and find that you do not have an offer of a job. So after the situational judgment test, and bear in mind there will be no virtual comms interview, all applicant scores will be collated and nationally ranked. As I said, offers to a scheme or region are usually made in May-June time according to ranking and preference. Applicants will be given 48 hours to accept or decline a post, and upgrading will be available for around a week after initial offers, which means that if a higher rank preference becomes available before then, you may be offered this. Once the upgrade deadline has passed, no more upgrades will happen. So the offer of a post will be subject to ranking and preferencing. It will be subject to you satisfactorily completing and passing your BDS. It will also be subject to your full GDC registration and eligibility for NHS Performer List entry by date of commencement of post, which will be the 1st of September. Please note that training does start on the 1st of September, and your employment will start on the 1st of September. So please make sure that you do not book any holidays or any other activity to coincide with the start of your training and employment. Sub-preferencing to practices has happened during COVID, but if there is no other mitigation, it will be to region or scheme only. And then the sub-preferencing to individual practices will occur within your local region, local HE office later in the year, once all the trainer recruitment has been completed. Please bear in mind that the appointment of trainers and sites often happens quite late in the year. So, and it does vary from year to year. So what's on websites currently in terms of training practices is there only for guidance. And trainer availability can change. All UK school applicants and graduates will be given priority for a dental foundation training place because they're not able to access the NHS Performer List otherwise. You will be informed by the end of January 2024 if you're deemed appointable or not appointable for dental foundation training in the coming year. If you are deemed appointable, please note that this does not necessarily guarantee you a dental foundation training post. The recruitment process is a quality assured process. The SJT process has been subjected to a full equality impact assessment. But we carry out continuous review of the process. We take feedback from those who are part of the process every year, and we identify lessons, and these are communicated to the relevant groups, which include stakeholder representation, so that we can improve the process further every year. It is important that you do provide your feedback so that we can ensure that the following year the process is even better. Please remember that Oriel is the recruitment system through which you need to apply to dental foundation training. Simply registering on the system doesn't mean that you've made an application for dental foundation training. Do take time to read the applicant guide and the Oriel applicant guide in full, because the vast majority of any queries or questions you have will be covered in the applicant guide. Do make sure, as I've said, that you give yourself enough time and you make that application, so not just the registration with Oriel, but the application itself before the closing date and time. And again, I will stress that late applications will not be accepted, whatever the circumstances. Do ensure, again, I will reinforce this point, that any fitness to practice issues, any disabilities, or any special circumstances must be requested at the point of application and to the required deadlines. It cannot be done post-application. Try and maximize your chances of success by positively ranking all the schemes or regions for which you're eligible. And to help yourself and your peers, when you get an offer, do accept or reject it as soon as you receive it, and that ensures that the process, the upgrades can work well, the process is smooth, and that everyone gets an equal opportunity to get posts. If there are any uncertainties or updates, then the Dental Foundation Training National Recruitment Team will send out regular updates via email to make sure that everyone is aware of the timelines and the decisions are made. Do make sure you check your junk mail regularly, because sometimes some email providers filter these emails into the junk mailbox. Applicants will receive emails via Oriole 2 and notifications to the email address used to register their Oriole 2 account. So just a reminder of the key dates. The most important thing is to make sure you've registered and you've applied between those 2 dates, Tuesday the 8th of August and Tuesday the 5th of September. Ideally sooner. Do not leave it to the last minute, because there'll always be a problem. There might be an internet issue, there might be another technical glitch, and we do not want to miss the deadline. The SJT, again, those are the dates, 8th of November to the 16th of November. And the preferencing and initial offers, we will confirm the exact dates, but will be around May to early June. From the 8th of August, again, to reinforce the advert, the application form, the person specification, and the guides will be available on the website. It is your responsibility to check your emails and to check the website within the published timeframes. So what about paid interview or SJT preparation courses? Please note that we do not run or endorse any of the SJT preparation courses. Example questions are given on the CopDent website along with the DFT application guide. Please do read the guide thoroughly before submitting your application. If you have any further questions, please submit a query through the applicant support portal. The link is here again. Please do not send any queries about national recruitment to CopDent or to regional teams. So finally, the education transition document. This was introduced in 2021 for Dental Foundation training. It was jointly developed by the Dental School Council, the General Dental Council, and CopDent. And the aim of it is to support you as learners and the educational supervisors when you start your foundation training. Year 5 UK graduates will complete the education transition document part A, self-declaring your competency outcome judgments before you leave dental school, and the dental school completes part B and discusses this with each student. You should then pass on your education transition document to your educational supervisor or supervisors at the start of your foundation training, because this will allow them to work with you to tailor the training to your individual needs. The data from the educational supervisors in terms of their feedback on the education transition document will be collated by CopDent, and it is passed to individual schools as well as Dental School Council and the General Dental Council. The data is anonymous. It is hoped that foundation dentists will support this process and allow the feedback to be shared by CopDent. So, any questions at this point? And I'm going to stop sharing. Miles, would you like us to take questions, or shall I pass it on to my Dental Foundation colleagues?
Pass on to the next two presentations, and then we can take questions at the end.
Okay, thank you. So if I can first pass you on to Dr. Amish Jethwa, who is currently undertaking a 12-month full-time foundation training post.
Sorry, hi everyone. My name's Amish. I'm completing my 12-month foundation experience. So I'm just going to go through just a little bit about me. So I graduated from the University of Leeds last year. I'm currently on the North London scheme, and I'm working at a practice in Winchmore Hill called Broadway Dental Care. So I've got this slide on, but I know Dr. Movahedi's gone through all of this, so I'm sure you all know what this is by now. In summary, like what I'd just like to add is it's just a really good transition from dental school to working as a dentist, and I think it's really important to complete, and I've gained a lot from doing it, so I'm just going to go through that in the next couple slides. So overall, my experience applying to some top tips. So it's very similar to what you guys will probably go through. Oriel basically becomes like UCAS track. So when you were probably applying to dental schools, it's a very similar website in terms of it. You're going to get updates and things like that through it. In terms of top tips, so just say make sure like was already mentioned, that you complete your application as soon as possible, and definitely get it checked by friends and family just before you submit it. We've talked briefly about like the SJT exam. It's quite similar to the UK CAT exam when you sat it a long time ago. Obviously, like we mentioned, there's loads of resources out there. There's dent questions which you can look over, and it's just about practicing for that. And throughout dental school, you'll kind of build up on all of those skills as well to help answer those questions. We had interviews when I was applying, but I know they're not doing that anymore. And then, as mentioned, you get on to preferencing the schemes. In terms of doing that, I'd just say definitely talk to other graduates from your dental school or anyone that you know in terms of their experiences on different schemes, because they really can provide you with the ins and outs of how their scheme has found it, because it does vary a little bit across each country. Also, it's maybe not something you need to start immediately thinking about, but sooner rather than later is just thinking about where you'd like to be around the country, whether that be like closer to home, or like you want to explore a new city, or live with friends, etc. It's good to start thinking about where you want to basically move around, because when you get the list of schemes, there's so many, so it can be a little bit overwhelming at first of preferencing all of that. But like we said, definitely put down like preference as many places as you'd like to go and work, and to be honest, I preferenced all of them, so all the way around the country, because even wherever you end up, it's really about what you make of the experience, because you can make anywhere really good experience. And then finally, obviously, getting the job, which will be the exciting bit at the end. Yeah, next slide. So I put this slide up. This graphic was a similar one to the one that they showed us at the start of foundation training, and I think it's a really good representative of like what this year's like. So from university to FD, I think you kind of leave university thinking that you're ready to go out into the big wide world, but I think this year it's really just shown that it's so important. Like it's the child's hill, like you're at the top when you graduate, and then when you start FD, you do think like, oh, do I remember anything? Like I remember when I started initially, I just remember thinking after the long summer that we'd had, like, do I even remember anything from dental school? But it's all there somewhere. Over the year, like I said, like I think this graph's really good, because it's not just the FD year. This is pretty much like the rest of our lives in dentistry. Like this career, you're always learning new things, so you're always gonna like basically develop and reflect on different things. And I know like reflection's a word that you probably hated all the way through uni, but it's a really big part of like what we do every day. Like you'll see one patient and then think about how you could have changed something, and it doesn't mean that you have to go away and write a reflective report or something on it, but even just thinking about it, like what you could have done different. And I think this year is really, really helpful to do things like that, because it's almost like a cushioning, because you've got a supervisor in your practice, and you can bounce ideas off them, and it's really nice. It's a nice environment to be in where you can learn a lot. Like I've definitely improved a lot in terms of my communication skills, and even clinically, you pick up lots of tips and tricks even from colleagues, even if they're not your supervisor, and things like that. So I think it's just a really really good year. In terms of my experiences in this foundation year, so foundation year is pretty much split into two bits. So you've got practice life, and then you've got your study days. So I'm on the North London scheme. So I know in like London and KSS it's slightly different across the different regions, but in London and KSS we had in-person study days, and I found them really amazing and really useful. You might think after uni, like, do you need study days anymore? But trust me, you're going to really appreciate them throughout the year. We were also quite lucky because foundation year started off with a lot of study days at the beginning, which I think is a really good refresher, especially after summer. So you kind of get back into the feel of like dentistry and just remembering, picking up things again, picking up a drill even. Like, study days they vary. They are broken down each week by topics, and quite a few of them in the London KSS region are hands-on. So it's kind of like a labs day that you have at uni, but a lot more in detail. Than the speakers are like specialists usually in whatever they're teaching, and they are like a wealth of knowledge to learn off. And a lot of the teaching is really useful because it's very directly relevant for practice, and it's about like how you utilize those skills going forward. In terms of the study days, like I said, you just need to like make the most of them. And I think one good thing as well about having the in-person study days is that there's other people obviously on your scheme, whatever scheme you're on, and the study days are such a good opportunity to meet them all, and basically make new friends. And they kind of become your mini support group throughout the year. So kind of like probably your friends at uni, the ones who do know a bit about dentistry, because throughout the year there'll be loads of times where you'll want to have like a rant or just discuss something, even like bouncing ideas off like how things work, like what you were doing and how things work, and talking to everyone else on your scheme can be really helpful. And I think it's so important throughout this year because like talking to someone about a little bit about dentistry when they know what's going on is really helpful because they can open your eyes to different things. In terms of practice life, you're kind of in practice for the majority of the year, obviously. So we had at the beginning 4 days in practice and then 1 study day per week. My study day was usually a Friday, which was kind of nice because it was something to look forward to at the end of the week. And it was kind of like, even though we were at the Eastman, it was kind of like an early weekend because it would end and then we would get to basically start our weekends, which was nice. But when you're in practice, I think it's such a good opportunity. It's very different from when you're at university. I think that was my initial reaction because at university everything's open plan and you've got friends around in different clinics, whereas this is like the first time you're kind of in like an isolated room just with your nurse. But it takes some getting used to, but it's really good. It's good fun at the end of it. You make some really good friends through your colleagues, and your educational supervisor is usually amazing, and they're like a wealth of knowledge in terms of helping you to develop and really getting the most out of your basically, and even in terms of treating patients, because it is a big step up from university. Like initially you'll go from probably seeing about like 5 patients properly across the university to probably seeing like triple 10 times that going forward, but you really get there. And this year is really about basically improving your skills and getting you to where you need to be in terms of decision making and things like that, and really making you an independent practitioner. These are just my top tips in terms of going through this year. I know I've mentioned it briefly already, but really reflecting on all your experiences. Reflecting was something I'm not going to lie, I didn't enjoy much at uni, but I found that it's such an important skill throughout this year because everything you do and every patient you see, there's a learning opportunity there somewhere. And sometimes it might not even feel like it at the time. Then when you think back on it, there's always a way you could improve something. Like I've mentioned already, talking to your fellow FDs on your scheme, and even just any friends you have across the country is really helpful, and like building that support network. And I think this year really does that. Making the most of your educational supervisor and your study days. Even the speakers on each study day, they're really great and really friendly, and a lot of them like share their like Instagrams or like email addresses, so even if you like ever need any help and things like that, they're always there. You've also got your TPD who is leading your scheme, who's really helpful throughout the year if you have any problems. And nurses, I have to say, in your practice are like definitely a godsend, because they have a wealth of knowledge as well alongside supervisors, and that it can just be really helpful to be on really great terms with your nurse. In terms of this year, it is different to uni. You have to manage your time, as well as it being really fun. There has been lots of like challenges throughout the year, but it is all part of the experience, and I think like it just makes you a better clinician overall as well. But yeah, you get to manage your time through practice and your diary, and I found that was something that was very different from uni, because at uni we had such a long time for patients. So this is like a really good opportunity to basically try to push yourself in different ways, and this year kind of gives you that time to do that. And just generally don't be afraid to ask for help. There's lots of people around. This year gives you that basically support network, even not just your FDs and your TPDs, but just there's a lot of people around that you can always turn to for help, and everyone's really helpful in terms of anything you need. Like I said, it is there's a lot to it. It is like a full-on year, but it's definitely a really great learning curve, and I don't think, like, looking back, I don't think I could have gone straight from uni to just not doing this, because this has just been such a good experience for me going forward. Has anyone got any questions at all?
Thank you. We might come back to you with some of the questions. Thank you very much for your presentation. So could I now ask Dr. Alice Rigby to give a presentation and her insight into foundation training?
Can you see that presentation?
Yes, thank you.
Screen. So I'm Alice, and I'm currently in my second year of longitudinal training in Leeds, and I'm going to talk to you about what longitudinal training actually is. So I graduated from the University of Sheffield in 2021, and I'm also doing the academic version of the Joint Dental Foundation core training, which is the 2-year longitudinal scheme run in Yorkshire. So my foundation training component is out of Hunslet Dental Practice, which is in South Leeds. And my dental core training 1 post is in Max Fax at Leeds General Infirmary, and I alternate weeks between these 2 different posts. So what is longitudinal training? So it's a 2-year programme that combines both your traditionally 1-year foundation training programme and core training programme. So how it works is you're in a mix of primary and secondary care settings, and there's an increase now of the number of community posts involved in this. So often I alternate weeks, but some places have 4 to 8 month placements between different positions. And at the end of it, you come out with having completed your foundation training and your dental core training, which are normally separate individual standalone years. Traditionally, the North East and Yorkshire have had the longitudinal schemes based in them, but there's now pilot schemes across most deaneries, so you're not just able to do it in a couple of areas. And the way it works is you're paid as a DFT in the first year and as a DCT1 in the second year, even though you're combining them throughout the 2. So the application process is the same. You're applying through Oriel at the same time, and then you rank the longitudinal schemes at the same time as all of the other DFT schemes. And one way of identifying the 2-year schemes is you can rank, you can filter the different posts by length, and the 24-month ones are obviously the 2-year scheme ones. So a little bit about foundation training. This is kind of a recap of what you've already heard, but you have an educational supervisor who's in practice with you and your direct supervisor, and then you also have a training program director who looks after a group of about 10 to 20 of you, and they're not based in your practice usually. You have a mix of adult and paediatric patients, and you provide treatment based on the needs of the area. There's an electronic system that you use for all your note keeping, which it might be different to dental school. And as you go along, you start to scale up and become more efficient with appointments and change the length of appointments as you feel more comfortable and as you grow through the role. You work on your own with a qualified dental nurse, which is very different to university, and you have your own patient list. And then you get support in from your AES when you need it, but they also see their own patients throughout the day. There's lots of expectations, similar to like the portfolio systems you'll have at university, and you attend study days, you'll be doing reflections, you audit, patient feedback, colleague feedback, tutorials, and work-based assessments. And this all helps evidence how you're growing over the year. So dental core training, the posts really vary dependent on the specialty you're in. Most DCT1 posts are in MaxFax usually, but that is diversifying a little bit. But mine is a MaxFax post. So this is just a little bit about what I do day to day. So I have on-call responsibilities, but often the longitudinal schemes result in a smaller on-call commitment just because you're having to move between different sites. Help manage patients on the ward, so inpatients in hospital. I go to A&E and assess and treat patients there. Assist on consultant clinics, so they may be trauma, oncology or general clinics. And then there's other clinics such as biopsy clinics, 2-week wait cancer referral clinics, and then minor oral surgery lists. You'll also go to theatre and help out, so head and neck oncology cases, trauma cases, dental alveolar and orthognathic, but they vary very much dependent on the post. So what are the benefits of doing a 2-year scheme? So you're in a larger team and you have more of a network, so you're not spending the whole year just being a dentist in a room on your own with a nurse. And you maintain familiarity with both the hospital and practice-based settings, so you don't have to take a break from one completely to do time in the other. You only have to go through national recruitment once because then you have a scheme for 2 years. You also, this gives a bit of stability because you know where you'll be for those 2 years. You've got a little bit of time to grow and then you've got time to develop projects over that 2-year period because you're in the same base with teams for longer. I think for me, one of the big things was skill transfer because it allows things you learn in the hospital setting feed into your primary care work and vice versa. You generally have fewer on-call commitments, which for some people is important. And you also get to directly compare the jobs of whether do I like secondary care dentistry or do I want to work in primary care because you're doing them both at the same time. There's always some challenges with these things. It's a lot to balance at an early stage because you're learning 2 new settings. It takes longer to find your feet in either of these. You've got more teams to know. So it's just a little bit, it preloads the learning curve, I think. You also have two portfolios to navigate simultaneously, and you are signed up for the 2 years. So if you get halfway through and realise that you really want to be an NHS associate, you have to finish the 2 years because you're not completed your foundation training until the end. So my personal experience, it's been a busy job. The LGI is a major trauma centre, so the MaxFax component is busy. And one of the key things I've learned is confidence in managing dental emergencies very early on, because I was assessing patients in A&E and understanding when a swelling required admitting to hospital and when it didn't. So this helped my risk management ability and foundation training a lot. You also get a lot of experience of managing medically compromised patients a lot earlier, which helps with your primary care and general dentistry work. There's lots of volunteering opportunities throughout different schemes, which is really a different side of it that I hadn't experienced beforehand. And you get time to develop projects, and partly because I'm on the research academic programme, I'm also used this time to develop being a member of the Leeds Amelogenesis Infector Research Group. And in practice, I recruit and consent patients for the CALM trial, which is a randomised control trial, which is a multi-centre one run in the area. And this is all led into my next post, which will be as an academic clinical fellow. So my top tips for foundation training and also longitudinal schemes is, to a certain extent, it doesn't matter which post you get, because all posts will give you extensive experience. So don't fixate too much on which one you get out what you put in, which sounds cliched, but it's very true. I would take on as many opportunities as you can. I've taken time to sit my MFDS during this time. You get involved with audits and then you can get presentations out of this. Volunteering, I've done work with refugees and homeless patients during my time on foundation training, and they're really valuable experiences, both for me and also you're able to give back. Keeping a logbook, I know it sounds very much like when you're keeping all of your tallies at dental school, but if you're wanting to specialise in the future, they'll want evidence, or even if you're applying for associate jobs, having portfolio cases that you've done with clinical photographs will be really helpful for that. And finally, the transition from dental school to being a foundation trainee is very daunting, but everyone is there to support you, and it is a year with this support network, or 2 years. And it's a steep learning curve, but it does work and you'll get there. So thank you.
Thank you very much. So just going to pass you on now to my colleague, Dr. Emma Elliot, who will talk about her experiences as an academic foundation dentist.
Sorry, it was taking a while there to sort itself out now.
Yes, that's fine. Thank you.
Fantastic. Yeah, so I'm here to talk to you about academic dental foundation training. So just to introduce myself, my name is Emma Elliot. I used to make coffee, hence the picture, but I'm a graduate from the Barts and London Dental School from 2021. So I job share with Alice on the academic JDFCT program. This is a 2-year program. It's the longitudinal scheme. It just goes by many different names. And my general research focus is on psychiatry and dentistry and the Right to Smile consensus statement, which is about oral health and those with severe mental illness. So because of these things, I really want to do an academic post. So academic dental foundation training is your normal dental foundation training, which is your 1-year scheme with a focus on study days, reflective learning, tutorials, educational supervision, and a transition to NHS dental care. Your academic time as part of this 1 year is 1 day a week with sometimes an academic personal development plan and an academic supervisor, and you can be linked to a host university or project. So the research that you bring to an academic dental foundation training post can be your own projects and your own research interests, or it can be something tied to the scheme itself. So specifically, I'm on the 2-year scheme. I'm just going to make it change slides. Deciding not to. There we go. So I specifically am on the academic JDFCT scheme. So I've put in the bottom there that means that is the Joint Dental Foundation Core Training post. So DFT and DCT, aka the longitudinal post, aka 2-year post. So this post looks like a dental foundation training post and a dental core training post mixed together to create a 2-year program that brings in activities from the 2 different jobs. So Alice and I, we flip-flop between the 2, 1 week dental foundation training, 1 week core training, and at the end of the 2 years, we'll come out with both things. In this post, my academic time is 1 day a fortnight. I have an academic supervisor and a personal plan, and my research specifically looks at psychiatry and dentistry and oral health of those with severe mental illness. So I get to bring my own stuff into this post. So sort of things you might need for an academic job include publications, conference presentations, considered future career goals, prizes, awards, or any specific research interests that you might have. To be clear, these are all desirable skills. They don't expect you to have all of these things, but if you've got experience of these areas, that will strengthen an application to academic dental foundation training. Academic posts are designed to make you develop all of these skills. They don't expect you to be a ready-made academic expert. They will train you in these things, but an application will ask you about whether or not you have any of this experience. So in terms of the number of jobs that are available, HEE started doing the academic scheme back in 2020. And in that instance, it was only 1 job, but you can see how over the years this has been scaled up. So of this year's cohort, there were 24 posts available. 6 were the 2-year programs, similar to what me and Alice were experiencing. So 2 were in Leeds and 4 were down in London. And then there were 18 academic jobs that were on the 1-year program. So there's plenty of jobs available. And therefore, who should apply? I think anybody really should. I think if you've got experience of any of the things that I just brought up, even if it's quite small, it's definitely worth an application because it gives you the experience of applying to an academic dental job, of which there are loads out there when you start looking in that sphere. But also, I think it's a valuable learning experience because it's designed to develop skills that are useful for your wider CV. So to apply to academic dental foundation training, you do the same as what everybody has already said. You register on Oriel. Once you've registered on Oriel, you apply for DFT as you normally would. To do an academic application, you must apply to normal DFT. When that application for DFT is there, a message will come through a few months later telling you about the academic applications. and that email will tell you what academic jobs are available and where. But you won't receive that communication unless you have an active DFT application. So if you like the look of the jobs and you want to do an academic job, then you fill out a second separate application. So at this point, you would have 2 active applications, and each application will then tell you what the next steps are and what you need to do to get through the process. So just keep an eye on your emails. Hopefully you get some job offers that come through. Academic job offers are made first because the process is separate from general dental foundation training. And once an offer is made on Oriel, you do have a short window to accept or reject. If you accept an academic job, no offers are made by your normal DFT application. So there will never be a situation where you can have an offer from your academic job and an offer from your normal DFT application and compare the two. As soon as an offer comes through from one of them, you have to choose it or reject it, and then you go from there. You can't just put 2 names into 2 hats and then compare what you get out of them. So what are academic foundation posts like? They're good because they let you explore academic clinical roles early on in your career. Once you're in these jobs, you notice how many academic jobs there really are, and they're quite daunting to get into later down the line. So this gives you a flavour of it at a really early stage. You get to develop and maintain your skills from university. You get a unique role that really does stand out on a CV because you get wider training, and the offers do come out earlier than national recruitment, which is always a bit nice. You get a bit of a heads up about where you might be going. The cons, it is challenging. This is exactly the same as what Alice said, because we've talked about these things at different talks to other people, but it is challenging. You're balancing your dental foundation training, your dental core training, and your academic elements. Obviously, if you're on the 1-year post, then it's just your academia and your dental foundation training, but this is still quite a bit to take on, so it does require a lot of organisation, and it is mostly self-led. You'll get some input, but they do expect you to sort of direct yourself because it's meant to be your academic interests, and then they will help you figure that out further. You do get reduced clinical time compared to your colleagues, simply because if you're losing either 1 day a fortnight or 1 day a week to academic training, you're not getting as much clinical exposure. But me and Alice have both found that that sort of normalises itself, to be honest. The post might lead you towards academic clinical fellowships or in practice fellowships, which is where you mix research with clinical work further on. You might take time out and do a PhD. You might take some time out to do specialty training, or you might return to general practice with a much wider portfolio than some of your colleagues. The final things to say are, don't be scared of trying something new and different. HEE has put a lot of money into these new career options, and they're constantly upscaling the academic programme. Don't be put off by the application process. The application form is quite generic and it's not specific to your level. So if it's asking you how many publications you have, and that seems like excessive for what you already have, then just fill out the application form anyway. And you might find that they weren't actually expecting you to have 6 publications or something silly like that. It's just a generic application form. Take advantage of these opportunities. You are a very young clinician. It's a great time to explore career pathways. And if you like academic clinical work, it's a good moment to take a step back and see what that's actually like. And then focus on your finals because you're very, very nearly there. So if anyone has any questions, that is my email address there. So I'll just leave that for a second. If anyone wants to take a picture of it, and I'll stop presenting and hand back over to Dr. Movahedi.
Thank you very much.
So I'm happy to go through some of the questions that we received prior to the webinar, Sana.
Yep, let's do that, please.
Just share my screen. Okay. Sorry, my camera seems to not be working, so I'll just talk through these questions. So we received some questions about allocation and people being anxious over the ratio of applicants to posts. So we always endeavour to allocate to everyone that's found appointable. the ratio kind of balances itself out when via withdrawals or deferrals, for example. So normally we place everyone. And then there was a question about competencies. So Sana or one of the other presenters, are there a certain number of UADs we have to reach during DFT?
So the blue, yeah, so Miles, the blue guide, I would recommend everyone looks at the blue guide, which is on the CopDent website, the updated version, which was updated in September 2022. There is a nominal target in terms of both UDAs and clinical activity, and that is covered in the blue guide. But my advice has always been to foundation dentists is try, rather than looking at targets, try and see the year as a year to try and get as much experience, both clinical and non-clinical, as you can while you're in a supportive and salaried environment. And that's the way I would look at it rather than focus or worry about targets.
I'll come back to the other one. So there was questions about working less than full time, and can people work less than full time? What might be some challenges? And yeah, Sana, I don't know if you're happy to respond to that.
I'm happy to answer that. So you can make an application to work less than full time. There has to be statutory reason for why you're opting to work less than full time. For example, you might be the parent or carer of a young child, and the region will then assess your application and see whether it is viable or not. The disadvantage of being less than full time is that actually what it does is the transition from being an undergraduate to a dental foundation is a very steep transition. And if you're less than full time, it takes you that much longer to find your feet and to make satisfactory progression. So it's just something to bear in mind.
Thanks. And then there was some questions about Oriel. So how to submit an application and how to use this portal. So the DFT NRO will publish advice and guidance for applicants on the DFT, so that's Dental Foundation Training website. So I put the link in the chat and it will be available in the guidance. Also, Oriel will have a resource bank on there, or have some FAQs and a help guide for applicants to help them navigate. There were some questions about overtime and additional work. So people have asked, is it possible to treat private patients? Are they able to take sick and annual leave, or is it overtime pay? And are people able to work on the weekends for private patients at the same clinic?
So the annual leave is there is a National Dental Foundation training contract. The annual leave is in line with statutory requirements, as is the sick and maternity and pay leave as well. Are you allowed to work privately? As a foundation dentist, you are being 100% funded by the by the NHS to work full-time to deliver NHS care and work in an NHS environment. There may be a very, very small percentage of cases which lend themselves to you undertaking them as part of your training on a private basis. We would envisage this to be less than 5% of your activity. Any additional role outside your full-time contracted hours will need to be approved by the postgraduate dental dean of that area, and there needs to be a really good reason why you're deciding to work additional hours. It is a full-on training and employment year, and the vast majority of people find the 35 hours is quite tiring in itself. let alone wanting to take on additional work at the weekends or evenings. And doing additional work, additional activities may well impact on your progression. So it's something to be mindful of, and the contract does stipulate that you do need permission of the postgraduate dental dean to undertake any additional activities above and beyond what you're contracted to do as a full-time foundation dentist.
Thanks. Okay, and then we had some questions surrounding paternity and maternity leave. So what's the policy for maternity leave? Is it the same as mat leave? Is there statutory pay? How long's the maximum? Paid and unpaid?
So paternity pay is, it'll be statutory paternity pay, and the amount and the time is in line with what is on the government website as well. It is restricted because the contract, your dental foundation contract, is a time limited fixed contract. So your contract won't be extended for you to get the additional maternity or paternity pay. But within that fixed term, if you are eligible for paternity pay in line with statutory requirements or maternity pay, that will be provided, and the time and allowances are the same as that's what you can see on the government websites around maternity and paternity allowance.
And just another one was, is paternity leave treated the same as mat leave, and that can they defer for that reason, defer their start to programme?
That will have to be a decision that will be made at a regional level by the regional postgraduate dental dean, and it will depend on individual circumstances and reasons for it. Deferral is not usually an option. It is only an option in exceptional circumstances.
Okay, and then SJT exams, what are they like? How can we best prepare for it? Would it be only an SJT or an interview? So I know personally there are no interviews this year. I don't know if you can speak about what the SJT would be like and how best to prepare for it.
So shall we go to our current foundation dentist colleagues, and maybe they can give their viewpoints on how they prepared for the SJT.
Yes, so the SJT, you can practice for it. There are the official questions on the website. Some people recommend using that, so medics also go through it, and they have some officially published questions, and they may or may not be helpful, but the structure of their training is different to yours, so it's being aware of that. My dental school ran quite a few evenings and courses on it, which were helpful, but it's not clinical knowledge. It's very much how would you react in this situation, kind of, and things to read up on your GDC 9 standard, like the book of all the standards. Like if you go through all of that, it does give you the answer to quite a lot of the questions because they are structured around that. So I think that would be my top resource to use, and making sure you know the timings, because there's no negative marking. So you answer every single question, even if you don't know the answer, because the way they're scored, even if you do put them in the wrong order for the ranking ones, you get some points. So it's better to answer everything at least.
Yeah, I'd second everything that Alice said. The GDC standards are probably the best thing you can look at when you're trying to answer these questions. I'd also say, like, there's loads of books and resources, like Alice said, the medic SJT questions are available too, as well as the Cop Dent ones. It's good to go through. I found it was useful to go through them individually, as well as talking to like your peers at university. Everyone has slightly different reasoning and things like that when they're answering the questions, and it can be useful to look at and discuss between each other. But yeah, exactly what Alice said in terms of the resources. There's the Cop Dent questions, and there are books out there and things like that. I'd say obviously they're not endorsed by HE and Cop Dent, so they are different. It's a little bit like the UK CAT. Nothing's going to be like the exam, the exam is, but they're good preparation resource, and the questions aren't always that accurate in the books, but like I said, it's a good preparation resource, and just looking at the GDC standards is probably the best thing you can do.
Okay, and there's a few questions about study days. So I'll ask a few and then ask a few more. So what is a study day? What usually happens? Can I choose my day? Are they compulsory?
So they are compulsory. You are paid and to attend them. They're part of your employed contracted hours. So attendance at study days is compulsory. Attendance and full engagement with study days is also part of the evidence used to ensure that you are able to satisfactorily complete your foundation training and become an independent practitioner. The study days are fixed for schemes, so you can't choose them. But what you can do is look at the scheme descriptors before you make your options and choices and see whether, some schemes will have it on a Friday, some on a Wednesday, some on a Thursday, Tuesday, and what suits you. And there's quite a lot of choice. For example, there might be some applicants who, for religious reasons, do not want to attend a study day on a Friday, in which case my suggestion is they look at schemes which have it on a non-Friday study day.
And then are London and Kent, Surrey and Sussex study days held together?
So generally all study days are scheme or local based. So within a region, for example, London and KSS, there are quite a large number of different schemes and each will have their own study days. However, there may be times when the whole region comes together for a regional study event, in which case all the schemes in London and KSS may come together in one site, one venue to have a regional event. That's true of all different regions, so it's not just in London and KSS. So generally, each scheme has their own local study day, but there might be times when you come together as a region and have one large study day with large number of applications.
And do all schemes have the same split of study days to practice life?
So generally, most regions will have anywhere between 25 to 30 study days. There is regional variation, and again, I would suggest you read the scheme descriptors that come out around about April time and study those and see what the descriptor says about the schemes. The current scheme descriptors are available for you to see. They are online, you can see them, but do bear in mind that the scheme descriptors do vary year to year as well. So they can give you a guide, but you can't guarantee that we're going to have the same scheme descriptors and schemes the following year. So bear that in mind as well.
And then there's some questions about circumstances and wanting to swap. So if people have a change to their circumstance and the post that they've got is not appropriate anymore, what options are available to them? And is there any kind of process for swapping once you have placement offered to you?
So we have to make sure that we're fair and consistent to all applicants. And from the numbers that we've put on the slides, you can see there is a huge number of applicants, and therefore swapping and changing things around after the upgrades is, number one, not fair on the majority of applicants who've gone through the due process. Number two, it breaks the written process and that we have to abide by, because we are quality assured by a number of organisations and stakeholders. And number three, what it does, it also delays your onboarding. So please don't underestimate the time it takes from when you've got your BDS results for you to get your GDC registration, to start your performer list application, get your occupational health sorted, your DBS sorted, all of these things sorted. And for lots of foundation dentists who opt to move to somewhere different, to get your accommodation sorted, to get your house or flat sorted. So delaying the process because people want to change their minds or want something different has a negative impact on everyone else, on the vast majority of applicants, and it can also negatively impact you in terms of your start date. And remember, you do need to have your GDC registration by the 1st of September. You need to have everything in place. That is condition of you starting your foundation training post. There may be very, very rare exceptions where there are an absolutely, unforeseen circumstance, often very sad circumstances like personal health issues, and that will then be at the discretion of the regional dental dean.
Okay.
But I have to stress those are very, very few and very rare, and the vast majority of cases, any applications to change once you've got an offer will not be accepted.
So we've got a question from an international student who would need a Tier 2 visa to work in the UK. They're asking, would all or any DFT clinics practices be able to provide sponsorship?
So the sponsorship is provided by the organisation, by NHS England, rather than the individual practice, and you are supported in that process.
Okay, and then someone studying in Scotland, would it be possible to apply for both VT and DFT?
It is possible for both those who are studying in Scotland, but also those who are studying in England, to apply for both Dental Foundation and the Scottish Vocational Training Programme. We are going to be working with our colleagues in Scotland to make sure that the dates are aligned, and we are in alignment as best as possible for the September 2024, because again, to be fair and consistent to all applications, what isn't appropriate is for someone to accept a post, to apply for both, accept a post in one, and then after upgrades are completed, pull out of that post, because then that post can't be offered to other UK graduates, and that's unfair, and it leaves a vacant post. So we are trying our best to align it so that the offers go out at similar times, and that is really to avoid a negative impact on all the other applicants, and to avoid having empty posts which could have been filled by UK graduates.
Okay, and then someone practices. So does each practice have a couple of FDs, or are you by yourself? And what DCT clinic would someone who wants to be a PED specialist need to train at?
So if I answer the first part, which is most practices have a single foundation dentist. However, there are quite a large number of practices that have training capacity to accommodate multiple FDs, and there will be practices that have multiple, 2 or maybe more than 2 or 3 foundation dentists. When you're sub-preferencing locally, once you've been allocated to a region, this is usually indicated in the descriptor for the practice, whether they have 1 FD or multiple FDs. If I go to Alice and Emma, whether you want to, I'm happy to answer the question about the DCT and PEDS, but if you want to answer it, and then I'll give my view.
So there's lots of different types of DCT, and it's a completely separate round to national recruitment unless you do one of these 2 year schemes. But I don't want to confuse you too much, because you do another round of national recruitment in your foundation year if you want to go on to do DCT. In general, to specialise in any dental specialty, you are required to have 2 DCT years out of a maximum of 3 normally. And there's person specifications online for all the different specialty training posts, so they give you a good idea of what your requirements are. Most say you need 2 years of DCT and don't necessarily stipulate which specialties you need to be in. A lot of trainees will do at least 1 year of maths. But there are some PEDS posts, some ortho posts, some oral medicine posts. They vary quite a lot. There's some split posts, but it's a national recruitment process again. So I wouldn't worry too much about going that further down the line, because you have an option for DCT 2 and 3 to do maybe more subspecialty other DCT posts as well.
Yeah, I think at this stage it's not something that can be majorly influenced because the longitudinal posts vary so much with each other anyway. But when you're looking for PEDS jobs later down the line, things like community dentistry, ortho, and then PEDS specific as well as special care can all be useful places to get those skills. But it's all very dependent on that specific year that you're applying in, and you just look at it at that time. I don't really have much more than that.
Thank you. And I would say that if you are absolutely sure that you want to go down the PEDS pathway, then do consider looking at the Joint Dental Foundation dental core posts, which are the longitudinal 24-month posts, which have an element in community. However, I would also say that people change their minds. So, you know, you may finish BDS and think you're absolutely going to become a max fac surgeon or a PED specialist, but the vast majority of people change their minds once they go through foundation training. So do remember that as well. Keep your options open, and you know, you may be pleasantly surprised that actually this, you know, you may like general practice, or you might do something completely different from what you had in mind, and there's nothing wrong with that at all.
Okay, and then some other questions were how many, so longitudinal training, how many spaces are there? Can you do on call, and is it a requirement to get MFDS?
So it's not a requirement to get MFDS for the longitudinal, but getting MFDS is helpful if you are going to go down a specialty pathway. Can you do on call as part of longitudinal? This does vary from depending on the longitudinal scheme. Some regions would prefer for you to be embedded and show progression in your foundation training initially before considering an on-call element in it. So I'd say it's a rarity rather than a regular event. The number of spaces and the number of posts for longitudinal do vary from year to year, but they are increasing. So all regions are now offering them. And the aim is to increase the number of posts and spaces for the longitudinal or 24-month programs.
Okay, and then there's
I
some.
don't know whether I'd like to go to actually Emma and Alice to just give their view on whether they had on-call as part of their longitudinal and in which part of the year it was.
I think the general rule is that most longitudinal posts don't involve on-call directly, but obviously that's specific to what happens in the department particularly. So sometimes if there's short staffing, that can change. But as a general rule, in your first year of a longitudinal, you're not expected to do any on-calls. And then when we got to our second year, Alice and I were given the opportunity to say if we wanted to take part in the on-call rota in a very informal way. So we have done on-calls in our second year, but I get the impression, Alice, if it's the same from you, that that was very much just led by the unit and whether or not they thought we were comfortable enough to do it. And then we were offered the opportunity and we had the option to sort of push back on that or go with it depending on how we felt.
Yes, I would agree. And partly because for us, we alternate weeks. So with the working hours, you can't do nights or you can't do weekends really, because then you'd be working 7 days in a row because you'd either be going into a practice week or coming out of a practice week. So we were a little bit more protected from some of the unsociable hours part of it in DCT. But yes, we both do day on calls, but not nights or weekends, but they vary post to post.
I think if you're worried about on-calls as a concept and you want your max fax experience or you want a similar sort of experience out of your DCT, then a longitudinal is a good way to look at it because it might be where you get a bit more protected exposure to that kind of working pattern.
Great. Okay, and then is the pay fixed within a longitudinal scheme, or the pay rate or the pay changes in the second year? Bracket DCT1 rate question mark.
So that was covered in one of the presentations that was provided by our foundation dentists. In the first year, it is to the Dental Foundation salary, and the second year increases to DCT1 salary.
Okay. When should we apply for the NHS performers list?
So I would encourage everyone, as soon as they got their BDS results, to get their GDC registration. As soon as you've got your GDC registration, to start the application for your performer list. The sooner you do that, the better it is. It does take time, and what you don't want to do is in the middle of your training be worrying about applications when actually you could have got that all done and sorted, or most of it done by during the summer break.
Okay. For DCT, some posts say general duties. What does this mean?
So we need to distinguish between DCT1, standalone DCT1, which is a separate process to what we've been talking today, to the 24-month joint Dental Foundation DCT posts, longitudinal posts that are part of the Dental Foundation training recruitment that we have been discussing. If you're doing a standalone DCT1, you apply for that during your foundation year, and it has a separate recruitment process. As part of that, DCT1 posts, some DCT1 posts do general duties, which usually cover things like oral surgery, and may cover some restorative aspects as well.
Does Wales and Northern Ireland offer these schemes?
So at the moment, I would suggest that you look at the descriptors that Wales and Northern Ireland have published. And as I've said, all regions are moving towards offering longitudinal programs.
Which schemes are the most competitive?
That varies from year to year. There is a published list of the ones which are competitive, which ones have been ranked more, but generally it varies from year to year. And it just depends on where people want to be and live. So rather than looking at everyone else, my advice would be, what suits you? What is going to be better for you? Do you want to be in the same place? Would it suit you to be somewhere different? One thing I would say is that the Dental Foundation training salary is the same wherever you are in the country. So you're not going to get a weighted allowance if you're in London or if you're in a major city. And yet the costs of living in somewhere like London are much higher. So do bear that in mind as well. And do consider posts that are outside urban areas, in rural areas, because actually the pace of life is much more gentle, and actually the training, therefore the training opportunities that you may have will be very different and very good.
So we've reached time. So for the questions that we couldn't directly respond to on this presentation, what we'll do is we'll formulate answers and then we'll circulate a kind of list of questions and answers for people. But yeah, I think we should call the questions there. Sana, if you're happy.
Yeah, I'm happy. Just in the last question, which is, what are the expected UDA targets? Again, that was covered in the webinar. Please look at the blue guide, which is on the CobDen website, which gives indicative targets, both clinical and UDA. But otherwise, thank you very much, and many thanks to Amish, Alice and Emma for very kindly giving up their evening and giving their experiences. So really grateful to the three of you. Thank you so much. And thank you, Miles and Temi, for you also giving up your evening and supporting this live webinar. Thank you to everyone who's joined us. Thank you very much.